Welcome to Inside Aesthetics, the world's leading podcast for injectors and aesthetic businesses. I'm Dr. Jake Sloan, an aesthetic doctor with over 16 years experience in facial aesthetics.
And I'm David Siegel, an entrepreneur and business mentor with over 20 years of experience in our industry. Our podcasts are aimed at industry professionals, and any information or advice given is general in nature. You should consult with a healthcare provider before undergoing any treatment.
You can also subscribe to us on Patreon for on-demand content for injectable and business education. Hello, mate.
Yes, hello.
How are you?
Good. We caught up for a lunch yesterday.
It was very nice.
Yes, haven't seen you socially in a while.
Yeah, down at Balmoral Beach, and we had a nice lunch.
It was good, actually. You got to see your kids who are all grown up now.
Yeah.
That was nice.
Moving on to some news.
Yep.
Next week will be our special 300th podcast.
Yes.
So quite excited about that. We've actually already recorded it, but that's entitled The Past, Present and Future of Aesthetics with Dr. Jean Carruthers and Dr. Michael Kane. So please listen out for that one. And I'm sure you will find it very interesting. It's our longest ever podcast.
Was it longest?
Yeah.
Okay.
Well, we didn't plan it that way. It just went that way because there was so much to cover.
Yeah. 2.5 hours.
Yeah. So we've divided it into two parts. Part one will be available as normal on your regular podcast app. For part two, it will be free. So don't worry, you don't have to pay anything, but you have to sign up as a free member to our Patreon.
Yeah. We want your details.
Yeah, we want your details, but also it does help us connect a bit better. We can market to you. We can tell you when stuff happens.
Exactly. And I guess to celebrate the 300th episode, as most of you already know, we love a good competition and no better time to do a big one than our 300th. So there'll be more information coming up about that very soon. So just check out Instagram next Friday.
Yes.
And there'll be some instructions there on how you apply. But the only hint that we can give you is you probably will need to pack your bags if you win this competition.
Yes.
Yeah.
And you might see us.
Yeah, you might.
Somewhere else.
Somewhere not in Australia.
Yeah. So look out for that competition. All the information will be on our Instagram and down below will be the information on how to sign up for our Patreon.
Yes. All right. So today we're joined by Tissue Repair and we're talking about their product TR Pro Plus, which is right up our alley when it comes to the regenerative episodes that we've just been discussing lately. So
we have two special guests from Tissue Repair. We've got Darryl Reed, who's the COO, and we've got Charlotte Meli, who's one of their BDMs, and also she's a cosmetic nurse and injector. So Darryl, maybe we'll start with you as you represent the company from a financial and operative perspective. Tell us about your background and how you got into aesthetics, because that wasn't your original background, was it?
No, look, it wasn't. Guys, thank you for having us on the podcast. No, my background initially kicked off as a molecular biologist, and I spent some time in Switzerland working on melanoma gene therapy. And when I moved back to Australia, realised that it's a pretty hard road being a researcher, and that probably wasn't for me. So I headed back to Canberra, where I grew up, and I worked at the TGA for 4 years and got to understand the regulatory framework as a public servant working there. The opportunity came to move to Sydney with Roche. They were after someone with a regulatory scientific background, but an interest in business. And that was really right up my alley. That's what I was after at that time. So I moved to Sydney and really for the next 20 years worked with Roche and Bayer in the consumer division. My role was really managing the commercial sales team that was working with doctors and specialists, but I had a role in clinical, medical marketing, product training. So really, most of my career was in a big multinational. And then it was probably, I guess, maybe 4 years ago that our CEO and founder, Tony Chirara, was looking for someone to join Tissue Repair, someone who had quite a varied background, who could have a lot of different balls in the air. And that's what my role encompasses at the moment. So I joined up probably 4 years ago, and really interesting contrast moving from a big multinational to a startup. And I've really enjoyed the challenges that come with the role. And as you can imagine, there's many different hats that I wear, but I love the science behind the product and I love talking about how we can channel that into a business proposition.
Great. Now let's introduce Charlotte. Tell us about yourself and introduce yourself to our listeners.
Thanks, guys. Thanks for having us. So I am a cosmetic injector and I work between clinics as a contractor, which many of your listeners do as well. And before that, I was a dermal therapist. So I've been in the industry now for, I think, about 14 years, so a really long time. And our founder gave me some product of TR Pro to try, and I loved it, which is why I jumped on board. And I saw that there was a real gap in the market for science-backed post-care. And since then, we've scaled very quickly. And yeah, loving being part of a startup and doing something different, and with such a great product of TR Pro.
Why did you want to go from dermal therapy to nursing originally?
Back then, I didn't want to own my own business, and it was a long time ago. And the next step was studying nursing. So I just did what the natural progression was when you don't want to open your own beauty therapy clinic.
So what was the purpose of the company? What did you guys set out originally to do?
Look, it's a really interesting story. The company originated, I reckon, back in the early 2000s. At that point, beta-glucans were starting to be better understood, and there was information being published that indicated that beta-glucans, and I'll talk a little bit more about this later, but beta-glucans coming from yeast could have a role in influencing the immune function. There was a vet called Graham Kelly. He worked at Sydney University at that time, and he had a number of different projects he was interested in, but he cottoned on to this emerging beta-glucan research, and he started to tap away a little bit on that. He found out a way to be able to purify the beta-glucan from yeast, and he really was looking at how that could be utilised in a medicinal form for wound healing. It's interesting because he was a vet, and Sydney Uni is not too far from Randwick Racecourse. If I look back in the archives, what I see are a lot of his handwritten notes and some photos where he'd been applying TR Pro to horses who had cuts on their legs. So that's where it originated back in the day. And eventually over the journey, they needed to sell those assets. And then Tony founded the company. He picked up the assets. He ran another 2 clinical trials. And really the clinical trials are really either chronic wounds or acute wounds. And so there was 2 different work streams. He built on the work done by Graham. He confirmed the positive indications they got from those trials. And that's probably when I came along, and the company was listed in November 2021 on the Australian Stock Exchange, and the money raised during that listing was really geared to support the phase 3 trials that would support the chronic wound workstream. What we didn't know was whether there was any application of the product for acute medical wounds or as a post-procedure product for aesthetic procedures. And it's safe to say that what we've learned in the short time we've been on market is that there are some really great applications and really positive feedback from some of the clinics that are using the product.
Let's get into some of the nerdy stuff, Jake, around the product, how it works.
Yeah, I guess let's define what is TR Pro Plus. What is it actually? What does it look like? How does it come? How is it applied? And what are the main uses of it?
Look, TR Pro Plus is a hydrogel product that represents a new standard in aftercare. The active ingredient of TR Pro Plus is a beta-glucan, okay? And a beta-glucan, if you imagine it just as a really complex sugar, it's composed of a whole lot of glucose molecules that are linked together. So when it eventually degrades, it breaks down into glucose and it's treated and metabolized in the same way as normal sugar would be. But prior to that, it's a really big molecule that if you imagine a chain of pearls and they're folded upon themselves, it's quite a complex ball, if you like. And that's what these sugars are like. Now, glucans essentially, in our case, make up most of the skeleton of yeast cell. And the yeast I'm talking about here is just baker's yeast, the one that's used for brewing beer, baking bread. We start with a bag of dried yeast, essentially, and we take it through a process where we strip out all of the lipids, all of the proteins, and we end up with a very pure API, active ingredient, which is the beta-glucan. We call our beta-glucan glucoprime, and that's really the active ingredient. Beta-glucans known not just in yeast, but they come in mushrooms, algae, bacteria, also some grains like oats and barley. But the structure of them is all very different, and it's only the glucans that come from yeast that have really been demonstrated to be able to influence the immune response, if you like. So that's our active ingredient.
So how is it signaling to the immune system, and why is that important?
When we formulate it in a hydrogel and you apply that topically, people used to think, look, these beta-glucans are so big, there's no way they're going to have a benefit topically because they're just too big to move through the epidermis. But what's been shown is they don't move in and out of cells as a lot of other chemical products might. They move between them. They're so big that if you label them fluorescently and you look at them on a slide, you see all the fluorescent label between the cells. And so they work their way through the epidermis. They get to the dermis. And they come into contact with macrophages. Macrophages are really our key management immune cell. They're hanging around, they're the guard cells, they're looking for any foreign pathogens, and they will take action on those if they need to. So when they come into contact with that beta-glucan, they know it comes from yeast. And as humans, we've evolved to be able to identify and detect yeast because it's not something we want in our dermis. So what happens is there's a physical contact between that beta-glucan and the macrophage because those cells have receptors on the surface that engage with the glucan. And when that happens, the macrophage becomes activated. And part of that activation is they start to produce growth factors and cytokines. They start to produce or influence the production of collagen. And the key is when this is happening in skin that's been compromised or damaged, it's really beneficial for those additional growth factors and cytokines in terms of accelerating the healing and improving the overall skin quality. The beauty of the mechanism is we're not trying to second guess what cytokines or growth factors might assist healing. We're really providing a stimulus at the start by using that beta-glucan to then allow the body to kick off the process that it would normally do to manage healing of the skin. So it's just a fantastic way to leverage what has evolved in nature and apply that to wound healing.
So is the beta-glucan sort of synthesized in a factory, or is it from the yeast?
We start with a bag of raw yeast. It's a 30 kilogram bag. It's not dissimilar to the little sachets you might buy in the supermarket. And then it's purified in a GMP factory. And because we have this chronic wound work stream going at the same time, and that is all being managed under an FDA, project, there's a lot of requirements around how the glucan is extracted, how it's produced. It's fully GMP, and it's done in the same way as normal pharmaceuticals would be manufactured. So it's all done at the moment. That's done in the US. That's where the active ingredient beta-glucan is produced. We then bring that back to Australia, and we have a contract manufacturer here formulate that into the hydrogel, which we know as TR Pro Plus.
Cool. So to summarize for a 10-year-old, because we're simple people, you put this gel or hydrogel on the wound. The beta-glucan basically tells your body, hey, you need to heal this because this molecule is already found in antigens like yeast. And so your body produces all the good stuff and the healing is better than without it. Is that essentially what you're saying?
Look, it is. And if I just go into a little bit more detail on that, I guess the thing is that we know healing is really complex. There's hundreds of factors that need to be switched on and off in the right concentrations at the right time. The macrophages drive that. And if we assume there's two types of macrophages, M1 and M2, what we've shown is that we can double the number of M2 macrophages. And it's those macrophages that control management of the inflammation, and they also control that initiation into skin remodeling. We worked with the University of South Australia over the last 12 months to demonstrate this, and we're just at manuscript stage of that data, and that'll be published very shortly. So we've got some very strong evidence that underpins that mode of action.
And what's the utility for skin that hasn't been damaged in terms of just everyday potential use? Are you going to get any upside with that?
Look, my experience is that the beta-glucan itself is an antigen, as Jake said. It's foreign to the body, and so it stimulates its own level of inflammation, but it's controlled inflammation. So you're going to get, as you apply just on normal skin, a level of macrophage activation. You're going to get additional macrophages drawn to the site, and there's going to be, one of the outcomes of that is additional collagen being produced. So I think you're going to get some plumping, firmness of the skin, probably some masking of fine wrinkles. And this is the reason we're probably looking at using it in more long-term anti-aging products like serums and things as well. But Charlotte, you might have a view on that also.
Yeah, when there's no trauma to the skin, I find that my clients definitely think that the skin is more hydrated and supple, and some of them use it religiously once a week as a mask just to repair the barrier if there has been any damage, or just to hydrate the skin and get the anti-aging benefits. So it doesn't always need to be applied onto broken skin.
Yeah. I don't know if you guys know the answer to this. How big is the molecule? Do you know? Because the reason I'm asking is because I teach for a polynucleotide company, and we're always taught that the molecule is too big to penetrate the skin topically, hence it's injected. Whereas a smaller version of the molecule called polydeoxyribonucleotide, or PDRN, you can use that topically that will go in. Now, you said, this molecule that we have, it's huge, but it does go through the skin. So I'm just wondering how that works.
Yeah, look, we do know how big it is. Generally, it's a heterogeneous mix of sizes, but the average size would be up around the 0.8 megadalton size. So it's a really big molecule. But why that's important is as it moves through and attaches to the macrophages, what's been shown is that it needs to be a large beta-glucan to activate the macrophage. If it's broken down into smaller beta-glucans, they can still attach to the macrophage, but they don't get the activation. And the challenge, like I said, this technology has been known for decades, but it's been difficult for people to make something or extract it and keep that large size. And that's a secret source of tissue repair, in being able to extract it from the yeast and still maintain that large size. In terms of how it gets through the cells, no one really knows. I guess it's a really hydrophilic product, and I guess it's something to do with ionic forces between the gel or between the beta-glucan and the cell membranes as it moves through. But it's really interesting, as I say, when you label it fluorescently, it's very clearly like mortar on bricks moving between cells.
Yeah. You mentioned you used to work for the TGA. Now, obviously, the TR Pro Plus is TGA approved for various indications that I know you've got to be quite strict on what you market it as and what it can do and what it can't do. But just tell us about the TGA approval process. We've actually tried to get the TGA on the podcast and so far been unsuccessful. So if you've got any contacts, let us know. But we want to know what goes on behind the scenes, because whenever we speak to pharma about when they're registering a toxin or a filler, it takes years. Yeah. And it's incredibly expensive, and they always find it very frustrating. So give us some insights.
The TGA is really interesting, and it would be great if more of the guys who worked there got out and worked in industry for a little while and then moved back. I think they'd get a different perspective. I loved my time there just purely because I'm sitting at the cutting edge of the new things that are coming through. But look, I think why Australia is a little bit different is that we have a pathway to registration that is called the listing pathway. And the listing pathway is set up for products that are very safe, and they're for products that are indicated for conditions that are minor and self-limiting. Now, typically they would be vitamins, minerals, herbal products, homeopathic products. But the way that framework works is that you don't need to undergo a formal 12 months in-person assessment. You essentially need to hold a dossier, and you need to declare that it's going to be manufactured to GMP specifications. You need to confirm that you've got the clinical data to support the indications, and then you need to select the indications that you do support, and it gets approved in a relatively short time frame. And so what we've got is a listed product that has been approved, but that's quite different to the prescription products or even the registered over-the-counter products, which would be things like anti-allergy or analgesic products. They go through a different process. So one of the challenges we have is when we're looking to expand in overseas markets, they don't have that framework. So we're looking at other ways to be able to facilitate that. And a medical device route is probably the most likely, because hydrogels are often classified as devices.
Interesting. It seems like Europe's easy. Just get a CE approval and away you go.
I think it is, but the challenge there is your claims are limited to the physical attributes of the product. You can't outwardly talk about the macrophage activation. But of course, because that information's published and it's in the public domain, that's still available for doctors in those areas. So yeah, that's the pathway we're leaning towards at the moment.
And in terms of what else is out there in the marketplace, what else would come close to what it is that you guys are doing?
Yeah, look, there are some beta-glucans on the market. Nothing that we are aware of has the extensive purification process that we do on our patented technology, which is glucoprime. So I'd say it's safe to say that we are definitely a cut above the rest in the beta-glucans that are on the market. They also aren't going through an FDA trial, and they have not been TGA approved.
What does the TGA approval actually allow you guys to claim then?
The indications that we have had approved from the TGA are those that relate to skin repair, skin regeneration, or refer to the antioxidant properties of TR Pro Plus. So essentially, it's able to be used on any occasion that the skin barrier is compromised in a condition that would be minor and self-limiting. So it doesn't apply to chronic wounds, for example. They would be a different category.
Okay, fair enough. Now, you mentioned you've done some studies and data. Can you share some of that with us?
Yeah, we did a double-blinded randomized control study post CO2 laser on the chest, and we saw up to a 40% increase in elastosis and reduction in wrinkling against the placebo. That was done on 42 patients, and the placebo also had a hydrogel formulation, however, not the active ingredient, obviously. So we were really impressed by that study. And then we've also done a real-world evidence study on about 12 dermatology clinics in Australia, and 100% of clients, or patients I should say, thought that TR Pro Plus was as good as, if not better than what they'd used before, in comparison to other really popular dermatology, often advocated for products on the market.
Right. And how did you guys measure the 40% improvement in wrinkles? Like, what is that based on? Is it imaging? Is it just patient-reported outcomes?
Look, that's a good question. By way of background, it was Mitch Goldman in San Diego who ran that study, and the two scales he used, there was one on wrinkling, one on elastosis. Both of those were validated scales. So the condition of the cohort was assessed at baseline and then reassessed at 28 days using those validated scales.
And so obviously one indication is obviously post-ablative laser, but what other indications might you use this for in a routine aesthetic clinic?
Yeah, so anywhere where there's heat or traumatized skin. So any ablative laser, non-ablative laser if there's heat in the skin, needling, RF needling, any injectable site to protect the wound, any time where you're doing lots of micro-injections, so PDO threads, impaired barriers, skin reactions that you might not know how to treat in the clinic. We have clients spot treating their acneic skin with TR Pro, rosacea. We've had good results post eczema. So a variety of indications for TR Pro. It's extremely versatile. It's for all skin types, including sensitive skin. It's pH balanced. You can use it if you're pregnant as well. And it's always going to reduce and calm the skin, take the heat out and control the inflammation. And with everything that we do now in clinic, there is so many devices out there that typically create, whether it be 48 hours or 24 hours of downtime or 7 days, you'll find that TR Pro Plus is a wonderful addition in your post-care routine.
And have you done any sort of research or have numbers in relation to like speed of recovery? Or
Darryl can speak more to the science behind, or the studies, I should say. However, the feedback in clinic, I would say, is that the skin is healing faster, and we've not had one instance of infection. So we have dermatologists using this product, cosmetic nurses, dermal therapists. We've even got plastic surgeons using this product on open wounds. And because there are two levels of defense, topically, as the barrier forms across the wound from the hydrogel, and then obviously in the dermis, we've not seen one instance of infection. And we've treated comfortably over 15,000 patients.
You piqued my interest when you said you can use it post-injectable. So tell us about your experience with that and what other people are playing around with. How are they using it, or why are they using it?
Yeah, so I typically use it post-injectables if I'm using a cannula. I typically use a 22-gauge cannula, so it's really important for me to make sure, especially on an older patient, that cannula site closes up pretty quickly, which in often cases it does. However, I find if I just use TR Pro as a back bar product instead of the typical bepanthen, then that glides over the injectable site and it creates a barrier once it dries, and that barrier will stay protecting the wound care site until it's washed off with water. So I can just be rest assured that my client's wound, whether it be that small or bigger, is looked after.
So are you using it more of a dressing or to actually heal the hole, or both?
Both.
Super interesting. So tell us more about the semi-permeable film that it makes over a hole, Darryl.
Look, I think hydrogels have been recognised for a long time as an ideal wound dressing, and part of that is because they form a semi-permeable barrier. So that allows, as Charlotte said, heat to dissipate post-procedure if that's important, but it allows oxygen exchange across for ideal healing as well. Also locks in transepidermal water loss. So you're getting a lot of the benefits that a silicone gel might provide, but you've got this active healing with the macrophages underneath as well. And the final thing is it's able to stop any pinpoint bleeding and manage any exudate if that's important also.
Yeah. Are there any contraindications for the use of the product?
Look, not that we're aware of. Because it's a really simple formulation, there's no fragrances or anything in it. It's neutral pH. We're seeing even on sensitive skins, they're quite comfortable in having this applied liberally. We haven't had any experience with anyone having an adverse event. At this stage, I don't think so. I think Charlotte would say probably just chemical peels where you haven't washed the site. That would be the only time you wouldn't apply it. Is that right, Charlotte?
Yes, if the peel isn't neutralized or if it's self-neutralizing, I wouldn't use TR Pro straight away. Otherwise, there is no indication where I wouldn't use TR Pro.
I want to go back to this semi-permeable film. It's interesting me now. So what does it look like? If you put a little spot over a cannula site, can you see a little white circle? What does it look like?
So it dries clear and non-tacky, which is why it's so comfortable for the patients. And I think that's also why it was described as much better than what the patients had used before in our real-world evidence study. You'll see a slight opaque film on the skin, but you can barely see it, which is wonderful. So your client doesn't go on with this sticky gel like some others in the past, or very glossy,
And then how long does that take to dry? And then when could they, in theory, use makeup or other topical skincare?
Yeah, it will dry in a couple of minutes, depending on what you're using it after. So if it's after an injectable site, it will dry in a minute or so. You only need a 1 millimeter thick layer. If it's post a CO2 laser, you're going to apply it 1 to 2 millimeters thick, and that's going to take maybe 5 minutes to dry. And I say to my clients, I only say this after anti-wrinkle injections just to be extra safe. But if I glide a layer over, say, the forehead, and my client, as they usually do, lunchtime treatments, want to go straight back to work, I say that's fine. As soon as you get back to the car, as long as the area is completely dry, you can pat sunscreen and makeup on top. It is a barrier, but it is going to peel off if it's rubbed, and it will stay on the skin until it's washed off with water. It's wonderful for clients that, especially after an ablative laser, really don't want to be touching their skin for 24 hours because it's quite tender.
Oh, yeah, for sure. And one of the other big problems with healing is the itching sensation that you can get as it starts to granulate.
Yes.
The people mad, and then the ones that are tempted to touch the skin, they can scar. So I have read that your product also has anti-itching capacity. Tell us about that, Darryl.
Yeah, look, it does. And I think that's part of it being able to control inflammation. So patients and eczema is a good example. Eczema is interesting because every patient is quite individual. So we're a little bit conservative in talking to eczema patients. We say, look, apply it in a small spot for 2 days. And if it's fine, then apply it more liberally. But we're getting really good case studies coming in, interestingly enough, on infants who have eczema flare-ups that can't control. So it's to do with that macrophage activation. The role of those macrophages, the M2 ones, is to manage inflammation. And of course, itching and heat and redness are all part of that inflammatory reaction. And when you apply it post-procedure, the patients feel that cooling, soothing immediately. And if you're doing a split face, they absolutely can tell the difference, which sides had TR Pro and which sides had something else.
Yeah, and we've compared a lot of really popular products on the market, including some exosome products, and we've always found that TR Pro has reduced the redness and controlled the inflammation a lot quicker in a split face trial.
Okay. What about things like hypertrophic or keloid scars, Darryl? Is there any sort of evidence suggests that it's helpful there? And if so, what's the protocol that you've seen work best so far?
Look, it's a good question. A couple of points on that. If it's an established keloid, it's probably not going to do anything unless there's some sort of physical intervention with laser or needling. But certainly applying this post that treatment, it's going to have benefits there. The data that we have, the evidence is quite clear in terms of what we've generated and what's published, and that is that the growth factors and cytokines that are influenced by those macrophages are favourable to normal scar formation. They manage that remodelling. There's a couple of them. TGF-beta-3 is one of them. It increases the production of that, and it's very well accepted that when that is produced in higher levels, you're more likely to have a normal scar form. So we believe that it's going to be super effective in helping scars. We don't have those trials yet simply because they are longer term ones, but that would be definitely something for us to look at down the track.
Yeah, there's just certain demographics of the population that no matter what, they touch their skin and they keloid scar. So it's could be a game changer for those sorts of scenarios.
Charlotte, you mentioned a thin layer of 1 to 2 millimeters, but how much do you need for a full face? How does the preparation come? Is it a small tube? Can you buy it in a big bucket? Like, how does it work?
A bucket eventually would be great. But no, it's 10-gram tubes only at the moment. And we did that because obviously we are very new to market and we weren't sure exactly what the uptake was going to be of TR Pro. And we are servicing dermatology clinics as well. So 10 grams at the moment, 10 grams will give you about 3 applications on a full face. So we often recommend that the clinic puts 3 tubes into a post-care pack, and that's usually safe to cover the 5 days of application to get the results of the study. If it's a wound, we recommend you apply TR Pro every day until the wound has healed, or every time the dressing has changed, obviously as recommended by your medical practitioner.
After a typical ablative laser, people look like a burns victim for 2-ish weeks. So anecdotally, or I don't know if you can throw any studies at us, like quicker is the healing versus nothing at all?
Look, I think we've really only got the anecdotal data to go on in that respect. One of the things that I was really impressed with early on was before Charlotte joined us, she had quite an intense needling procedure, and we took a sequence of photos and it showed at 2 days she was getting some shedding around her nasolabial folds. Now, Charlotte would say that, look, that would not normally happen until day 4. When we're seeing something like that's happening a couple of days or 1.5 days earlier than normal, I think that's probably a fair indicator of where we would peg it. But those studies still need to be done.
Would you also share the venous leg ulcer that we're doing with the FDA trial, how quickly that healed?
Yeah, look, that's the other work stream, the chronic wound work stream. They're venous leg ulcers. They're up to 12 centimetres squared. They are big, angry, smelly, painful wounds on older patients. They stay in that constant inflammatory stage. So as new tissue begins to be laid down, it's just chewed up because you've got cells there that are trying to clear dead tissue. So they never progress through that healing stage. What we've shown in some cases is that we're able to close some of those wounds within a matter of 8 to 10 weeks. And they might be, in one case, there was a wound that hadn't been able to be closed for 4 years. It was from a patient at Heidelberg Hospital. That's not typical for all sorts of wounds. Some of them are still very difficult to close. Some of them don't close even with TR Pro Plus. But we're seeing, I guess what's happening is it's just really re-triggering the wound and starting to allow it to get ahead in terms of laying down some new tissue because it reduces the inflammation there.
Yeah, those venous ulcers are horrendous. I used to do a lot of vascular surgery work, and the problem isn't so much just the wound, it's the pressure in the leg and the poor blood flow and all the rest of it. So
yes.
It's quite complicated, but it seems to make more sense for me on a freshly made wound with a laser.
Yeah, controlled.
Yeah, it's way more controlled on otherwise healthy tissue.
Yeah.
So totally different. I understand why you've got 2 arms to your product.
Yeah. Now, in some of the literature that you sent through, I remember reading something around talk of, I guess, supporting the skin function through what's called ceramide production. So can you talk to us a little bit about what that means?
Look, I think any time the barrier is compromised, ceramides are going to have a role. They're the waxy layer that really adds that integrity to the skin barrier. And where the skin's broken or damaged, they're going to need to be rebuilt. What we know is that, again, some of those growth factors and cytokines that are upregulated by macrophages directly lead to production of ceramide. So that gives us strong evidence that, you know, what's going to happen when we apply beta-glucan or we apply glucoprime to compromised skin, it's going to accelerate that rebuilding of that ceramide layer.
Okay.
Great. Now let's talk a little bit about the business side of things and maybe clinics who are interested in getting this into their clinic. So Charlotte, you're one of the sole people going around the country, or at least the state, supporting clinics. So what's your experience been with people's early experience with the product and obviously newer clinics who are learning about it?
Yeah, like with any new product, it takes some kind of pushing to get clinicians to try it. And obviously, I know what it's like to be on the other end of that. But once clinicians try TR Pro Plus, especially when they do a split face trial on their clients, themselves and their clients are immediately sold. So we've had a lot of excitement around TR Pro, and we are selling minimums of 24 units per month. And that just shows that the versatility of TR Pro, it's not just post-ablative laser, it's post of a wide variety of treatments in clinic. And there's a lot of excitement and we're growing really quickly. And it's nice to have an Australian company also that's providing a product that has this much data behind it.
Sure. Can we talk specifics around pricing? So pricing for a clinic, pricing for a potential patient. We're in a tight economy at the moment. People
Yes.
have the answers to this stuff.
Yeah, so what I will say is we are cheaper than the typical post cares that are on a lot of cosmetic clinic shelves.
Charlotte, you sound like my girlfriend when I say to her, how much were those shoes? And she says, they were actually 80% off. But how much were the shoes? Sorry, I couldn't resist. Carry on.
Oh, no, I don't know where to start. So TR Pro Plus is only $38.50.
Right.
Per tube, and that is recommended retail price. For the client, it's not a large expense, even if you were to buy 2 or 3 in comparison to the current repair balms that are on the shelves at the moment. And to the clinic, it can get as cheap as approximately $17 or $18 per unit. It just depends on the volume that you purchase. And we have some really great opening specials that tailor to different clinics and where they're going to use TR Pro. And we are usually happy to also accommodate each clinic at the moment because, as I said before, we're still early days.
Cool. Yeah. So it sounds like you said you can use it on laser, injectables, RF needling, eczema, wounds, maybe even trial it with acne or problematic sensitive skin. What about my shaving burn? Maybe try that as well. Just
Absolutely.
got sensitive skin. It just happens all the time.
Yeah. Maybe we can get some for your personality.
There we go. Yeah. See if it can sort me out. Get those macrophages working.
What about, I guess, future development? What potentially is coming down the pipeline? I can see a TR Pro Plus skincare range at some point. It makes sense. That's probably where you're going.
Look, I think, first of all, Jake, on shaving burn, that's what I use it for as well. So I would encourage you to have a crack at that because it's fantastic for that. Yeah, as I said, I think a little bit earlier, we're looking at formulating a serum. So that will contain other ingredients like niacinamide, hyaluronic acid. It will be something that is more geared toward anti-aging and maintenance. There's just so many applications. The problem is we're just a really small company. So at the moment, we're engaging potential partners to look at the next stage of scale-ups and whether that is distributing in the channels that we're already in, or this is going to have application in a veterinary sense as well. So there might be partners out there who are interested in taking along those lines also.
Wow. It's fascinating.
Yeah. I think we're just still at the beginning of where all this kind of technology can go. Can you see it moving beyond like what you do on the surface of the skin? Could you see it being used in other applications outside of just that?
Look, what's interesting is I alluded earlier to beta-glucans also being found in grains like oats and barley. Now, they're a different structure of beta-glucan, but what's been shown with those is when you take them orally, they work on the immune function in the gastrointestinal tract. So they're being used for some of the gut inflammatory conditions, and they're getting some good results there. Beta-glucans have also being used as adjutants for some sort of oncology treatments as well. There's a range of different indications outside of topical that they're being used for. But one of the challenges is that there's no clear, consistent way that the beta-glucans are extracted and produced. And so what that means is if one lab produces it in one particular way and applies it in a given indication, it doesn't mean that another lab who makes their glucan in a different way will still get the same result. And that's why it was important for us even though there was published literature on how the beta-glucan might work, it was important for us to show that this beta-glucan that comes from this form of yeast and is produced in this special way, these are the results that you're going to get. And you can be sure that you're going to get a consistent result every time you use this product.
I've thought of 2 future uses of your product. These might be crazy, but hear me out.
Okay.
One is an injectable form. And I know that completely changes your TGA approval, et cetera, et cetera. Even if you're putting it on topically, you'll know it's going into the skin,
yes,
your target. So if you could develop an injectable form, so rather than a PLLA filler, you create a beta type injectable that you use to then stimulate the body to heal on already healthy skin. So that's one thing that I'm thinking of.
Yep.
Second one is you maybe could impregnate surgical stitches with this stuff, because then you get better wound healing and less likely of leaks of, I used to do lots of bowel surgery, and that's one of the sort of major complications when a stitch fails and you get a leak from something that you've tried to join together. But if you can get better healing, controlled healing, there you go. I've given you 2 business ideas.
Look,
there.
The impregnation is an interesting one, because you'll know there's a lot of physical matrices that are used in different circumstances, grafts and things like that. And those would definitely be open to some sort of impregnation with the glucoprime to, as you say, control that healing. Yep, you're spot on with that. Not a day goes by when I'm not surprised at thinking how much effort goes into just progressing as far as we are, and to take things that extra turn, hopefully down the track, we've got the resources to be able to do that.
Yeah, Jake will want 10% for that.
I'll be in the advisory board. And
I understand. It's coming through the email now. Yeah.
Guys, thank you. That was a really fascinating chat. Charlotte, I know you're so close to my clinic. I'd love a free tube so I can have a play with
10%.
my
Free, give me a free tube.
Yeah. But no, joking aside, we should definitely do a simple trial, because we're doing lasers every day. I don't personally do them, but the team does. And one of the problems of converting patients, or even my patients, to do lasers is the downtime. They're scared of it. They don't want to go through with it. They don't want to look red. They don't want to get itchy. It's a real thing. So yeah, we should do our own little trial and see how we go.
It could be good Patreon content too.
100%. Yes. Great. We'll put all of your details at the bottom of the podcast description so everyone can connect with Tissue Repair. And thank you both for your insights. It's been a great chat. And
let us know if there's anything new that comes out. We'd love to talk about it.
We'd love to, guys. Thanks again for having us on. Really appreciate it.
Thank you.
No problem. Take care. See you later.
Bye-bye.
For our latest news, follow us on Instagram at Inside Aesthetics Podcast. If you want to get in touch with myself or David, follow us on Instagram as well at Dr. Jake Sloan and David_Inside Aesthetics.
Join our Patreon for invaluable business and injectable education. Get access to our global community of like-minded professionals, live and interactive Zoom sessions, hints and tip videos, webinars, and more. Head over to www.insideaesthetics.com/Patreon for more information.